Hello and welcome back to our fourth Kyte Perspective event about home care management and hospital and home management. Today we have Ian Beck from Q Minutes, co-founder and CEO. Ian, a very short introduction from yourself, please.
Hi, so thank you, Anita. Q Minutes, just a quick question what we are. So we're an AI-focused solutions company. Our platform is a secure encrypted AI-powered B2B data management platform where we help organizations boost productivity, streamline automation, workflow repetition, and document generation in minutes. By leveraging the advanced tools, Q Minutes can enhance the workplace efficiency, promote accountability, and we foster stronger team collaboration. So some of our products range from out-of-the-box note-taking apps to file note management solutions to AI scribe for medical professions, and also working strong with Kyte for field and Oracle application services.
Awesome. And for anyone who has missed it, so Ian has already chaired one of our sessions a bit earlier where we're all talking about the AI bot actually automatically pre-filling any forms, medical forms and other things, just by listening into a clinician's and nurse conversation. But today I'm super excited about. So today we actually talk about an AI call bot. And for me personally, still a very controversial topic because, I mean, how good can an AI call bot really be? So I hope, Ian, that you're going to show us that today. But before we go into the actual demo, I wanted to debate a little bit about where AI is going in general. And for whoever doesn't know us, so Kyte Consulting, we are an Oracle technology consulting partner in Australia with about 40 to 50 consultants. And what I see as being an Oracle consulting partner is that AI is starting to be embedded everywhere, in the data layers, in the infrastructure layer, in the application layer. And it's going away, well, it's not going, but it's developing from, I'm just going to ask AI a question and I'll get a summary or a better written text, or a smart goal or whatever the task is, to AI is more and more embedded in actually executing core business processes across business units, And that's also something what Ian and myself have discussed here specifically for the home care industry, to say, well, how can an AI callbot not only have a friendly chat with a patient, but how can an AI callbot actually also take away admin work and be connected with the home care management platform? So the thing I wanted to discuss again before we go in is AI and healthcare management is also a bit of a concern for healthcare professionals because, you know, what happens if the AI recommends, a remedy, a care plan, or gives the patient some medical advice, which an AI is actually not entitled to do? So, Ian, practically speaking, how would we manage that with an AI bot in terms of where does the AI stop to give advice and what type of advice can an AI actually give?
Yeah, thanks for that. So these bots, we actually give them the construct. It's not an open house discussion. So when we build these specific agents for these, whatever these specific tasks are, especially in the medical industry, we will make sure that we will give certain rules and regulations, like never go outside the space of the patient information, never go and provide recommendations, and always refer to a GP or a specialist when it comes to medical advice. That's something we don't do, and we definitely put that in so that there's no clinical judgment or decision-making or complex conversations through the particular AI bot. That should always be referred back to a human person.
And that can be configured like that, right? So the AI bot will never cross that line to tell a patient they need to take extra medicine or that they should be doing this, right? Unless it's the AI is trained.
100%. Never tell them, how often you should take it, when you should take it, what sort of medications you should take. That should always be constructed to that script to never go beyond their requirements.
Yeah, awesome. Ian, I'm so keen to see the AI call agent. Can we show that of how this works in real life?
Yep. Should we just go into the demo?
Yes.
So what I'm going to do. So quickly, so we've built this particular agent for this particular demo where it's been given 4 primary actions. One is to we're going to simulate a typical outbound call with an inbound call. It would then also it's been constructed to also have the ability to ask for schedules or appointments, and also general information known about general public information about drugs and their effects, as well as just general advice, but nothing that is important or leads to medical decisions. So what I'm going to do now is just simply call the AI bots, and just patient with me. I'll just go. So you can call this through your telephone, or through the Kyte services through a scheduling system. It can actually call back the patient directly to their mobile device. So let me just call the phone. I'll put on loudspeaker.
Please wait while we connect your call to the AI voice assistant, powered by Q Minutes. Okay, you can start talking.
Hello, and thank you for contacting K-Assist, the virtual assistant for All Care Medical. I'm here to help with appointment requests, general health info, or collecting feedback from recent visits. This call may be recorded for quality purposes, and your privacy is respected in line with our clinic policy. How can I assist you today?
Just put in a quick pause. So what's interesting about these is that when we design these agent calls, it's all customized. So depending on the clinician's name, their policies, their introductions, this is all personalized through our scripting process. So let's start with a typical scenario. I'm actually going to start a scenario of doing an inbound call to have some feedback from a clinician visit. So I'm just going to follow a particular script. Hi, I just want to do a feedback from my recent visits of a clinician.
I'd be happy to help with that. Can I ask your first name and roughly when your recent appointment was?
Yeah, it was Ian. I think it was last Tuesday around 2 p.m.
Thank you, Ian. I'll now ask a few short questions about your recent clinician visit, one at a time. Did the nurse address your questions and concerns during the visit?
Well, she answered a few questions, or a few of my questions, but I had some concerns about my breathing, my swelling my legs, and I don't think they were fully looked into. I felt maybe she was in a bit of a hurry.
Thank you for sharing that, Ian. I appreciate your honesty. We'll take note of your feedback regarding the concerns about your breathing and swelling in your legs. Let's move on to the next question. Did the nurse take enough time to properly assess your health?
Not really. She checked my blood pressure, asked a couple of questions, but didn't check my feet or listen to my chest like they usually do. I'm not sure if she got the full picture of how I've been feeling.
Thank you for sharing those details, Ian. I understand your concerns about wanting a more thorough assessment. Did you feel the nurse consulted with you respectfully and clearly during the visit?
Oh yeah, she was polite. No complaints about that, but sometimes I felt a little trouble hearing her. She spoke kind of fast, and I didn't want to keep asking her to repeat herself.
I understand, Ian. Thank you for letting me know. I'll note your feedback about the communication pace. How would you rate the friendliness of the nurse, from 1 being poor to 5 being excellent?
I'll probably say a 3. She wasn't rude or anything, but she really didn't take time to chat or make me feel very at ease.
Thank you for sharing your honest feedback, Ian. Now, how would you rate your overall experience with our All Care Medical Management service?
I'll probably give it a 3 as well. A 3 as well. I do appreciate being able to get the home care. That part has been a real big help. But I wish the visit had felt a bit more thorough and less rushed.
I appreciate your feedback, Ian. I'm I'm glad to hear that the home care service has been helpful and will take note of your comments for improvement. Is there anything we're doing especially well that you'd like to highlight?
Yes, the people who called to schedule and confirm the visits were always very helpful and kind. And the fact that someone comes right to my home is wonderful for someone like me who doesn't get around anymore.
That's wonderful to hear, Ian. I'm glad the coordination and convenience of home visits have been beneficial for you. Lastly, is there anything we could improve to make your experience better?
Maybe just give the nurse a bit more time with the patients like me. Sometimes it takes us longer to explain things or ask questions. And I don't want to feel like I'm holding up anyone, but it would have helped if they spoke a little bit slower so I can actually understand sometimes.
Thank you for that suggestion, Ian. We'll certainly consider ways to ensure our nurses have enough time with patients and communicate at a comfortable pace. Thanks so much for sharing that feedback. Would you like to leave a message or note for the clinic team?
Probably just a quick one, but I do appreciate what you guys are doing. Just hope next time it feels more a bit personal and probably less of a checklist.
Thank you, Ian. We appreciate your understanding and will keep your feedback in mind to make future visits more personal and attentive. If you need anything else, feel free to call All Care Medical at 555-2323 or visit allcaremedical.com.au. Take care, and we wish you good health. Goodbye.
Right, so I've actually put the call on pause. So
yeah, that is fascinating. So, and this is, Ian, just to check in. So even though you've prepared that script, but the patient could come up with any random question, right? And the AI, it's just like generative AI. The AI would be able to deal with whatever comes up, right?
Yes, 100%. So we built this based on, perhaps a certain questions that the clinic or the hospitals would like to set in as guidelines. But from those guidelines, we can actually tell the AI to be quite strict or quite loose, or go a bit further into negative comments or things that causes a bit more an impact that can be helpful to support the patient.
Yeah, excellent. But look, what about things like, rescheduling an appointment, right? So I know I got a message from a home care provider that my nurse is coming tomorrow at 8 a.m., but I want to reschedule it to the afternoon. Could the AI bot help me with that as well?
100%. Let's go into the second scenario. I'm just going to continue with my conversation with the AI bot.
Sure.
And follow into the scheduling. Hi, I know there's going to be a home visit tomorrow, but can I please request a reschedule?
Thanks for letting me know. Just to clarify, are you looking to reschedule the same type of appointment, like another home visit? Or is this for a different kind of appointment with the clinic?
No, this will be a home visit, please.
Great, I can help with that. Could you please tell me your preferred date and time for the new home visit appointment?
Probably next Thursday at 4 p.m. if that's possible.
Thank you, Ian. I will pass along your request for a home visit on Thursday at 4 p.m. to the clinic team. Can I confirm the best phone number or email for the clinic to follow up with you?
Yeah, sure. 555-2222.
Got it. I've noted your phone number as 555-2222. I'll forward this information to the clinic for rescheduling your home visit. If they need to confirm anything, they'll reach out to you at this number. Is there anything else I can assist you with today?
Right, so I've just put it back on pause, but so eventually, sorry, Anita?
Yeah, that's super. And for our audience, the way the technical stuff works in the background, right? So that AI agent would be connected with the Kyte hospital home solution or home care solution, and would put a draft new appointment in there, or a draft reschedule appointment for an administrator just to confirm and, or change or confirm whatever the system puts forward as a recommended rostering.
100%. And the confirmation can be done backwards through the AI calling back to the client, or just a text message for confirmation.
That's it. So the AI can also do outbound calls and give a phone call back to the patient and said, I have confirmed your appointment next Thursday, 4 p.m., yeah?
Yes, 100%.
Excellent. Wow, super. What about the medical questions? So let's assume, oh my God, I'm a chemotherapy. I'm a chemo, like I have chemo at home, chemotherapy, and I have horrendous side effects. And I just want to speak to someone about the side effects and what I can do outside of the home care treatment, right? Like, is there any foods I should eat or not eat, or what helps me? So or any kind of medical, not advice, but sort of frequently asked questions. Or I may have some questions around the medicine I'm taking and potential side effects. Is this something that our iBot could handle as well?
Yeah, totally. So we can open up the generative model to ask publicly known questions about side effects or medications. But then also through our platform, hospitals and clinics can also provide their own internal references so that we can then use the AI bot to refer to that, so that becomes very compliant responses.
Awesome. Could we play through a scenario like that? And then also, so the next question that maybe we can do this in one scenario. If the patient then in the conversation says, I'm actually, what I'm trying to say is the patient shares that they're actually significantly ill and maybe it's actually best to see a doctor. The question I have is, would the AI bot pick up on that and refer the call to a doctor for triage? So that's the two things I'd love to see whether the AI callbot can handle generic questions, but also if the questions are more actually needing an actual doctor to get involved.
All right, let's start with the generic questions, and I'll try to remember your question about the chemotherapy.
Or whatever scenario is relevant, right? You pick one.
Yeah, I can do some basic ones though. Hi, I'm getting some really big migraines. Can you give me some typical drugs that would be able to help me in that aspects?
I can provide general information on this. Over-the-counter pain relievers like ibuprofen or acetaminophen are commonly used to help relieve migraines. However, it's important to consult with a healthcare professional to determine the best treatment for your specific situation. If your migraines persist or worsen, please speak with your GP for further advice. Is there anything else I can assist you with?
So I'm doing chemotherapy at the moment, but I'm a bit concerned with some of the side effects. But can you tell me what typical side effects can I potentially have?
Certainly. Chemotherapy can have various side effects, and they can vary depending on the type of medication used. Common side effects include fatigue, nausea, vomiting, hair loss of appetite, and increased risk of infections due to lowered white blood cell counts. It's important to discuss any concerns or side effects you experience with your oncologist or healthcare team for personalized advice and management.
So I think that kind of responded to your two questions, Anita.
Yeah, it's great. And I think, anyone who has home care treatment, there's always extra questions, right? I mean, and people find it on ChatGPT or just doing home research or are not asking the questions at all. But I think that callbot could be such an amazing addition to have it in conversation around, what things do I need to consider, or I'm experiencing this. Do you have any tips for me? That is great.
And also, what's also valuable, for example, it was an outbound call through the Kyte services to the patient. We can also provide some follow-up information that's required by the GP of the patient who's actually under the medical care. After, of course, we validate who the person is with some information. So we can have that background story and follow-up using the AI call.
Like, thinking out loud. So you put, for example, a patient on some new medication, and 3 days later you have that automated outbound call to the patient and say, how are you going with the new medication? Do you experience any side effects? Have your symptoms mildened, right? Do you want to consult with your doctor about any concerns? I mean, this is fantastic.
Yeah, and it's all about a whole bunch of this entire process is all about helping and alleviating, the administrative task, so that the teams and the teams can work on more complex activities.
And then coming back to, I guess, one of my last questions is, if the patient says, oh my God, I have shortness of breath and I think I'm going to pass out, and the AI is detecting a medical emergency, what would happen in that scenario?
So I think we've built in the script, but here, this is where we can refer and call up directly an emergency line. The AI has been built not to handle directly those questions, but let's try that and see how it works. Here, it's not plugged into call, but it will tell you have to reach out to an emergency. We can specify also to reach out to an emergency number as well.
Yeah.
Hi, I'm having really serious breathing problems, and it's hard to move. What should I do?
I'm sorry to hear that, Ian. If you're experiencing serious breathing problems, it's important to seek immediate medical attention. Please call emergency services or have someone take you to the nearest hospital emergency department. It's crucial not to wait in situations like this. Is there anything else I can help you with?
So in this particular response for our demo, we've just done that typical, but for a specific service to a hospital or clinicians, we can give more information of how to respond to the emergency, redirect to a number, or get in touch directly to emergency lines, to a human person.
Yeah, or you can also, I'm assuming, set it up to say, if I call in and they said, well, I actually want to speak to a doctor, that it immediately forwards it to a doctor as well, yeah?
Yes. And so, but that, yes, 100%. And that will rely on the policies of the hospitals or the clinicians.
Yeah. Fascinating. So see, that's why I love working in technology. That's so cool, Ian. Thank you so much for sharing this. I think it's absolutely exciting, to play through all these various scenarios with AI. One interesting fact you shared with me in preparation for this was, humans are actually more likely to ask embarrassing questions to an AI bot than to a human. So do you want to share some of your research insights on that, Ian?
Yeah. There's quite a consensus study, especially around the US medical, that 60% of most inbound calls to schedule or to do an appointment, people prefer to talk to an AI bot because they're a bit kind of embarrassed about the sort of information they're presenting, or they feel like they're being stigmatized or just sensitive disclosing information, as opposed to having the AI collect the data, prioritize it, and make the triage to then pass it along to a GP or specialist to review. So it's definitely been a big impact of how AI can help in that sector, especially around the inbound calls.
Yeah, I found it fascinating. And again, a really good use case for getting people more comfortable with speaking with technology and leveraging AI also for medical questions, which they may be holding back from their, clinician or nurse or doctor because just out of pure embarrassment. The other thing I wanted to ask you, what about different languages, right? So we're both here from Melbourne, a very multicultural city. All languages of the world are here, and probably in any other bigger city as well. How does the AI handle different languages?
Oh, that's true for the AI. The model can handle over 40 or so plus languages. I can quickly give a demo. I speak French and Vietnamese, so let me try and switch it and see how it works. Bonjour, je voulais prendre un rendez-vous, s'il vous plaît.
Bonjour, je peux vous aider avec ça. Pour transmettre votre demande au cabinet, je vais vous poser quelques questions pour qu'il puisse faire un suivi adéquat. Quel est votre prénom, s'il vous plaît?
Merci, mais on peut arrêter là, s'il vous plaît. Merci, au revoir. So that's an example. I won't go through the entire process, but I've asked it to set up a meeting, and so it's going.
Pas de problème.
So it's gone through the entire process, but I'll put it on mute so we won't have to hear the French. But likewise, if the inbound or the outbound call is to someone who prefers to speak in a specific language, we can set up all the parameters. So the call will be in their language especially for the elderly who, if they prefer to be in their natural language, we can easily set that up.
And then would the AI bot translate it back to English?
So
for the admin team and for the nurse to in writing or summary notes and whatnot?
100%. So everything is all streamed back to the Kyte services and it'll be back in the English language or any language the platform needs it to be.
Yeah, that's amazing. And I think you can also give the AI bot a persona, right? You can say, be super polite or be short and firm and factual, or is this also true? You can kind of give the bot a specific persona as well.
Yeah, we can bootstrap the scripting and the persona to be patient, be strict, be controlled, depending on the type of call, the outbound call or the inbound call as well. But also the generative model can also adapt to the user's call. So if it's an elderly person who needs to have a lot of repetition or needs the AI to talk slower or to rephrase their question, they can all do that at runtime.
Yeah, amazing.
It never gets upset. It never gets upset, basically.
Yeah. This is great. I have no other questions other than, I love what I'm seeing. The future is super exciting and I can't wait to see technology like this being used much more widely across, not only healthcare and home care management, but across so many other industries as well. I mean, I can think about so many different scenarios where you could use a call bot, right? Whether you manage a service center or a call center or a customer complaints, a customer request. Oh my God, I mean, the opportunities are endless. So if anyone from the audience here wants to get in touch with myself or Ian, please just reach out. As you can tell, we're very passionate about what we do here. And there's a lot of different ways how we can use the technology. Ian, any final words from your side?
No, I think one of the key benefits, because there's time short, it's 24/7. It doesn't need a person behind the phone. You can call up at 3:00 in the morning. It will do all the triage level 1, level 2, so that will alleviate the human factor. And the communication is always consistent, standardized, and patient. So that's one of the real big bonuses of having this. But it's generative, so it's human, it's learning, it's understanding, and it will talk to you at your own pace and tone.
Yeah, that's great. And it's scalable, right? So if you have, if there's 10 people calling at the same time, it can answer them and people are not sitting somewhere in a waiting line and other problems we sometimes experience.
Yeah, especially in peak seasons or in outbreaks or emergencies, it will be able to open, we just open more doors to be able to handle the multitude of calls.
Yeah, fascinating. Brilliant. Thank you so much. Any questions, please get in touch, pop them in our LinkedIn channel or reach out in private if you want to keep it private. Ian, thank you so much for this really insightful journey today and story today. And I'm sure we speak soon. Thank you and goodbye.
Thank you.